Okay, so now let's start with chapter 40 of your Apurba Sastry Essentials of Microbiology, which is about food poisoning. In this chapter, we'll be previewing the etiology, the food poisoning onset within 1 to 6 hours, 8 to 16 hours, and more than 16 hours, botulism, and mycotoxicosis. Introduction. Food poisoning refers to an illness acquired through consumption of food or drink contaminated either with microorganisms or their toxins. It usually results in common source outbreak of diarrhea. Foodborne illnesses is a significant public health problem. It is a major cause of morbidity and an infrequent cause of mortality. Globally, an estimated 600 million, 1 in 10 are affected with foodborne illnesses and 4.2 lakh die every year. Children under 5 years of age carry 40% of the foodborne disease burden with 1.25 lakh deaths every year. Diarrheal diseases are the most common illnesses resulting from the consumption of contaminated food, affecting 550 million people with 2.3 lakh deaths every year. Now, etiology. The table, microbial causes of foods have been listed in the table. Various etiological agents have specific food source and have different incubation time, which can be grouped into less than 6 hours, 8 to 16 hours, and more than 16 hours. Several non-microbial agents can cause food poisoning, such as capsaicin found in hot peppers, a variety of toxin found in fish and shellfish, and some chemical poisons. So let's review these microbial agents of food poisoning. Organism within 1 to 6 hours of incubation period. Staphylococcus aureus and Bacillus cereus. So these cause symptoms like vomiting, diarrhea, abdominal cramps. Common food sources of Staph aureus are ham, poultry, salad, mayonnaise, pastries, dairy products, and Bacillus cereus are fried rice. 8 to 16-hour incubation period. Clostridium perfringens, abdominal cramps, diarrhea in beef, poultry, legumes, gravies, and Bacillus cereus, abdominal cramps, diarrhea in meat, vegetable, dried beans, and cereals. More than 16-hour incubation period. Vibrio cholerae, watery diarrhea, shellfish, water. Enterotoxigenic E. coli, watery diarrhea, salad, cheese, meat, water. Enterohemorrhagic E. coli, bloody diarrhea, ground beef, salmi, milk, raw vegetable, apple juice. Non-typhoidal salmonella, inflammatory diarrhea, meat, eggs, milk, juice, raw fruits and vegetables. Shigella species dysentery, potato, egg, salad, lettuce, raw vegetables. Vibrio parahemolyticus, dysentery, raw or uncooked shellfish, particularly oysters. Campylobacter jejuni, inflammatory diarrhea, poultry, raw milk or water. Clostridium botulinum, flaccid paralysis, diplopia, dysphagia, homemade improperly canned food and honey infants. Listeria monocytogenes, fever and myalgia, pregnant women, soft cheese, raw sprouts, meat, seafood and milk. Norovirus, watery diarrhea, vomiting, abdominal cramps. Salads, fresh fruits, shellfish such as oysters or water. Cyclospora, watery diarrhea, abdominal cramps, raw fruit or vegetables and herbs. Mycotoxicosis 6 to 24 hours depend on the type of fungal toxin. Example, aflatoxin causes hepatoma, nuts, maize, wheat, cereal, etc. In food botulism, symptoms can begin as early as 6 hours or up to 10 days later. So starting with the first category, the food poisoning with onset within 1 to 6 hours. The pathogens which liberate pre-formed toxins in food have a short incubation period. The symptoms of food poisoning can commence within 1 to 6 hours of consumption of food as the toxins are already present in food. The classical examples include Staph aureus enterotoxin and Bacillus cereus emetic toxin. Staphylococcal food poisoning. Staphylococcal food poisoning is usually caused by contamination of food from infected human carriers. If food is left for a long time after cooking, the organisms get an opportunity to multiply and produce enterotoxin. Enterotoxin is expressed by nearly 50% of Staph aureus stains. It is preferred preformed toxin secreted in food before consumption so that it can act rapidly. As a result, the incubation period is short, 1 to 6 hours. Site of action. The toxin stimulates the vagus nerve and the vomiting center of the brain. It also appears to stimulate the intestinal peristaltic activity. Symptoms. Staphylococcal food poisoning is characterized by nausea, vomiting, occasionally diarrhea, hypotension and dehydration. However, there is no fever. Symptoms generally resolve within 8 to 10 hours. Most common source of infection is a food handler who is a carrier of Staph aureus. There is no secondary spread. Most common food items involved are ham, poultry, salad, mayonnaise, pastries, and dairy products. Staphylococcal enterotoxin is a heat-stable toxin and is resistant to gastric juice. Serotyping. Enterotoxins can be typed into 15 serotypes A to D, E, G to P. All act as superantigens. Type A is the most common to cause food poisoning. Serotype F does not cause food poisoning but causes toxic shock syndrome. Detection of enterotoxin in food is carried out by ELISA or latex agglutination test or by detecting enterotoxin gene by multiplex PCR polymerase chain reaction. Treatment is entirely supportive by correcting fluid and electrolyte imbalance. Bacillus cereus infection, it is a normal habitant of soil, also widely isolated from food items such as vegetable, milk, cereal, spice, meat and poultry. Clinical manifestation. Food poisoning. Bacillus cereus is an important agent of food poisoning in man, mediated by producing two types of toxins. Diarrheal toxins cause diarrheal type of food poisoning and emetic toxin cause emetic type of food poisoning. Emetic toxin is a heat stable preformed toxin resembling Staph aureus enterotoxin. In this table, we can see the difference between the diarrheal type and the emetic type. Bacillus cereus, incubation period of diarrheal type is 8 to 16 hours while emetic type is 1 to 5 hours. Toxin of diarrheal type is secreted in intestine similar to E. coli heat labile enterotoxin, and emetic type is preformed toxin formed in diet similar to Staph aureus enterotoxin. Heat labile, the diarrheal type is heat labile while the emetic type is heat stable. The food items contaminated in diarrheal type are meat, vegetables, dried beans, cereals, and emetic type are rice, Chinese fried rice. Clinical features of diarrheal type are diarrhea, fever, abdominal cramps, and of the emetic one are the vomiting, abdominal cramps. Serotypes involved in diarrheal type are 2, 6, 8, 9, 10, 12. Emetic type are 1, 3, 5. It acts immediately on intestine so that the incubation period of food poisoning is short 1 to 6 hours. It is associated with the consumption of contaminated fried rice with emetic toxin. The heat resistant spores of Bacillus cereus can survive boiling. If cooked rice is not refrigerated, the spores can germinate and produce toxin. Frying before serving may not destroy the preformed heat stable toxin. The symptoms are similar to that of Staph aureus food poisoning. Diarrheal toxin. Organism secretes this toxin only after entering into the intestine. Hence, the incubation period is longer, 8 to 16 hours. The other manifestations of Bacillus cereus include ocular disease. It causes several keratitis and panophthalmitis following trauma to the eye that may lead to loss of vision. Systemic infections. It rarely causes systemic infections including endocarditis, meningitis, osteomyelitis, and pneumonia. The presence of a medical device or intravenous drug use predisposes to these infections. Lab diagnosis. Bacillus cereus can be isolated from feces by using selective media such as MYPA, mannitol, egg yolk, polymyxin B, phenol red, and agar. It is a gram-positive spore-bearing motile bacillus. Bacillus cereus infection treatment. Bacillus cereus is susceptible to clindamycin, erythromycin, vancomycin, and tetracycline. It is resistant to penicillin by producing beta-lactamase and trimethoprim. Food poisoning with onset with now second category, food poisoning with onset within 8 to 16 hours. These organisms produce toxin in the intestine after consumption of the food and therefore have a longer incubation period. Bacillus cereus diarrheal type of food poisoning. It is mediated by the diarrheal toxin which resembles E. coli heat labile enterotoxin. Hence, here the diarrhea and abdominal cramps are characteristic, but vomiting is uncommon. Clostridium perfringens. Food poisoning has a slightly longer incubation period, 6 to 24 hours, and results from the survival of heat-resistant spores in inadequately cooked beef, meat, poultry, or legumes. After ingestion, toxin is produced in the intestinal tract, causing moderately severe abdominal cramps and diarrhea. Vomiting and fever are uncommon. The illness usually begins suddenly, is self-limited, and lasts for less than 24 hours. Clostridium perfringens mainly causes skin and soft tissue infection, gas gangrene. Now the third category, food poisoning with onset more than 16 hours. There are a number of organisms for which the manifestation occurs late, more than 24 hours after the consumption of contaminated food. Vibrio cholerae. Symptoms begin 1 to 4 days after exposure, characterized by watery diarrhea, nausea, abdominal cramps, vomiting, fever, and chills. Common food sources include contaminated drinking water or food such as seafood, raw fruit, and vegetables. Enterotoxigenic E. coli cause watery diarrhea after 3 to 4 days of exposure associated with contaminated salads, cheese, meat, and water. Enterohemorrhagic E. coli cause bloody diarrhea associated with contaminated ground beef, salami, raw milk, raw vegetables, and apple juice. Around 5 to 10% of infected people develop a life threatening complication. Salmonella non typhoidal symptoms begin 6 hours to 6 days after the exposure, characterized by inflammatory diarrhea, fever, abdominal cramps, and vomiting. Common food sources include contaminated chicken, turkey, meat, eggs, unpasteurized raw milk, juice, raw fruits, and vegetables. Shigella cause dysentery associated with contaminated potato, egg, salad, and raw vegetables. Campylobacter symptoms begin 2 to 5 days after exposure, characterized by diarrhea, often bloody, abdominal cramps, and fever. Common food sources include raw or undercooked poultry, raw unpasteurized milk, and contaminated water. Fibro parahemolyticus cause dysentery associated with contaminated seafood such as shellfish, particularly oysters. Listeria symptoms begin 1 to 4 weeks after the exposure, usually affects the pregnant women who develop fever and other flu-like symptoms such as fatigue and muscle aches. Elderly people may develop meningitis. Common food sources include soft cheese, raw sprout, meat, seafood, and raw milk. Infection during pregnancy can lead to serious meningitis and sepsis in newborns. Norovirus. Symptoms begin 12 to 48 hours after the exposure, characterized by diarrhea, abdominal pain, nausea, and vomiting. Common food sources include contaminated salad, fresh fruits, shellfish such as oysters or water. Other sources include the infected person touching contaminated surfaces. Cyclospora symptoms begin 1 week after the exposure, characterized by watery diarrhea, loss of appetite, and weight loss, abdominal pain, bloating, increased gas, nausea, and fatigue. Common food sources include raw fruits or vegetables and herbs. Botulinum food poisoning. It is associated with consumption of homemade, improperly canned or fermented food, beverages, and honey infants. Contaminated with botulinum toxin of Clostridium botulinum described subsequently. Mycotic poisoning is a rare case of food poisoning caused by fungi. Lab diagnosis food poisoning. Medical history taking regarding the ingestion of specific food and the time of onset of diarrhea after a meal can provide clues to the bacterial cause of the illness. Vomited stool or the unsuspected food material are the ideal specimens. Processing of food specimen, viable plate count, direct quantification. Viable plate count or standard plate count is the standard method for direct quantitative culture. Food sampling, 10 gram of food material is taken in a sterile container and is homogenized in 90 ml of sterile diluent. Example, Ringer's solution. For the food contaminated only on its surface, such as intact vegetable or fruit, 100 gram of food is taken in a sterile container containing 100 ml of sterile water and then shaken well so that all the bacteria present on its surface will come out and dissolve in water. Food processing. Serial dilutions of homogeneous or diluent is made and then plated onto appropriate medium. Pre-enrichment culture. Pathogenic bacteria from suspected foods can also be isolated by agar culture after pre-enrichment, which helps in recovery of any damaged organisms, followed by selective enrichment promoting the growth of the target organism. Toxin detection. ELISA-based formats or latest agglutination tests are available for the detection of enterotoxins in stool. PCR for detection of genes encoding for enterotoxins. The treatment. The mainstay of treatment is adequate dehydration and electrolyte supplementation. This can be achieved with either oral dehydration solution or intravenous solutions, example isotonic sodium chloride solution, Ringer lactate solution. Other symptomatic treatment can be given such as absorbents, example aluminum hydroxide and anti-secretory agents such as bismuth subsalicylate. Antitoxins such as heptavalent botulism equine serum antitoxin can be given if food botulism is suspected. Antibiotics such as penicillin or metronidazole may be attempted for botulism. Diet. During episodes of acute diarrhea, patients often develop an acquired disaccharidase deficiency due to washout of brush-bordered enzymes. For this reason, avoiding milk, dairy products, or other lactose-containing foods are advisable. Antibiotics. Usually, antibiotics do not play much role. It is mainly indicated for shigellosis, where fluoroquinolone, example ciprofloxacin, is the first-line agent. In suspected cholera, azithromycin is the drug of choice. Now, botulism. Clostridium botulinum is a gram-positive spore-forming obligate anaerobic bacilli. It produces a powerful toxin called botulinum toxin which causes botulism, a rare disease manifested as various clinical symptoms ranging from food poisoning, wound infection to infant botulism. The term is derived from Latin word botulus, meaning sausage, as poorly cooked sausages were formerly associated with food poisoning. It is ubiquitous in nature, widely distributed as saprophyte in soil, animal manure, vegetables, and sea mud. Pathogenesis: Clostridium botulinum is a non-invasive. It is pathogenic. Pathogenesis is due to the production of powerful neurotoxin botulinum toxin Bt, probably the most toxic substance known to be lethal to mankind. Serotype: botulinum toxin can be typed into 8 serotypes: A, B, C1, C2, D, E, F, and G. Serotypes A, B, E commonly cause human disease, most severe being the serotype A. All serotypes produce neurotoxin except C2, which produces enterotoxin. Bt type C and D are bacteriophage coded. Bt differs from other exotoxins as it is produced intracellularly, not secreted, and appears outside only after autolysis of the bacterial cell. Toxin is synthesized initially as a non-toxic protoxin. It requires trypsin or other proteolytic enzyme to convert into active form. Mechanism of action of Bt: it produces flaccid paralysis. After entry, either ingested, inhaled, or produced in a wound, botulinum toxin is transported via blood to peripheral cholinergic nerve terminals. The most common nerve terminal sites are neuromuscular junctions, postganglionic parasympathetic nerve endings, and peripheral ganglia. It does not affect the CNS. PT binds to acetylcholine receptors on the nerve terminals and neuromuscular junction, which results in blockade of release of acetylcholine, leading to flaccid paralysis. Therapeutic uses: as Bt reduces flaccid paralysis, it can be used therapeutically for the treatment of spasmodic conditions such as strabismus, blepharospasm, and myoclonus. Botulinum toxin is also produced by other Clostridia such as Clostridium butyricum, Clostridium barati, and Clostridium argentinis. Recovery: blocking of acetylcholine release is permanent, but the action is short lasting as the recovery occurs within 2 to 4 months once the new terminal exons sprout. Spores do not produce toxins. Toxin production therefore requires spore germination, which occurs in an aerobic atmosphere. Spores do not normally germinate in adult intestine, however, may germinate in the intestine of infants. Clinical manifestations: the manifestations of botulism are due to the decreased acetylcholine in cranial nerve and parasympathetic nerve terminals. Manifestations which appear after an incubation period of 18 to 36 hours, which include diplopia, dysphagia, dysarthria. Descending symmetric flaccid paralysis of voluntary muscles, decreased deep tendon reflexes, constipation, there is no sensory or cognitive deficits, respiratory muscle paralysis may lead to death. Types of botulism: foodborne botulism. It results from consumption of foods contaminated with preformed botulinum toxin. Most common source: homemade, improperly canned, or fermented food and beverages. Most cases are sporadic, outbreaks are rare. Wound botulism. It results from contamination of wounds with Clostridium botulinum spores. It presents like foodborne botulism except for the absence of gastrointestinal features. It can be recurrent in injection drug users, example black tar heroin. Infant botulism: it is the most common type, accounts for 75% of total cases. It results from ingestion of contaminated food, usually honey, with spores of Clostridium botulinum in children less than 1 year of age. Spores germinate in the intestine, releasing the toxin. Manifestations include inability to suck and swallow, weakened voice, ptosis, floppy neck, and extreme weakness, hence called floppy child syndrome. It is self-limiting, managed by supportive care and assisted feeding. Rarely it progresses to generalized flaccidity, respiratory failure, and sudden death. Adult intestinal botulism. Rarely in patients with suppressed normal flora, the colonized clostridial spores may germinate producing toxin, as in infant botulism. Iatrogenic botulism: it results from the injection of overdose of the toxin while used for therapeutic purpose. Inhalational botulism: aerosolization of spores may occur as an act of bioterrorism. Lab diagnosis. Diagnosis of botulism includes isolation of the bacilli and demonstration of the toxin. Isolation of the bacilli. Gram staining of smears made from suspected food or feces reveals gram-positive non-capsulated bacilli with subterminal oval bulging spores. It is motile by peritrichate flagella. Isolation. Culture is done on blood, agar, or Robertson cooked meat RCM broth. In RCM broth, they can be either proteolytic or saccharolytic, turning the meat particles into black and pink respectively. Growth on culture media may be confirmed by gram staining, and biochemical tests may be automated methods such as Malditov. Serotyping is done with specific antisera. Now, the toxin mediated The mere presence of bacilli in food or feces is of less significance. Toxin demonstration is more meaningful. Toxin demonstration, mouse bioassay. Toxins can be detected in the specimen, serum, stool, bone material, or in the samples of ingested foods. Specimens are injected into mouse that develops paralysis within 48 hours, which can be inhibited by prior administration of specific antitoxin. The sensitivity of the mouse bioassay varies inversely with the time elapsed between the onset of symptoms and the sample collection. Treatment. Meticulous intensive care support is needed, such as mechanical ventilation if respiratory paralysis develops. Botulinum antitoxin should be administered immediately on clinical suspicion without waiting for lab confirmation. Earlier the administration, better is the cure rate because antitoxin can neutralize the unbound free toxin molecules. However, once toxin binds to the nerve endings, antitoxin has no role. In wound botulism, suspected wounds and abscesses should be cleaned, debrided, and drained promptly. Antibiotics such as penicillin or metronidazole may be useful. Now, coming on to mycotoxicosis. Mycotic poisoning is a rare cause of food poisoning caused by fungi. The disease can be classified into two varieties, mycotoxicosis and mycetism. Mycotoxicosis refers to the disease produced by consumption of food contaminated with toxins liberated by certain fungi. Mycetism refers to the toxic effects produced by eating poisonous fleshy fungi, usually different types of mushrooms. Now, the features of common mycotoxicosis. Mycotoxin aflatoxin produced by Aspergillus flavus, Aspergillus parasiticus, Aspergillus nomius, and Penicillium puberilum. Source nuts, maize. Clinical condition hepatoma, hepatitis, Indian childhood cirrhosis, and race syndrome. Fumonisins from Fusarium monoliform in maize. Clinical condition equine leukoencephalomalacia, porcine pulmonary edema, carcinoma esophagus. Trichothecans in Fusarium graminearium, source maize, wheat, sorghum. Clinical condition elementary toxic eleukia, biological warfare, yellow rain. Ochratoxin by fungal species Aspergillus orchius, Aspergillus niger, Penicillium verrucosum. Source cereal bread. Clinical condition nephropathies, Balkan endemic nephropathy. Cyclopiazonic acid, Aspergillus flavus, Aspergillus viscolor, and Aspergillus oryzae. Penicillium cyclopium. Groundnut corn. Clinical condition codua poisoning, contaminant with aflatoxin. Zearalenons produced by fungal species Fusarium graminearium. Source wheat maize. Clinical condition genital disorders in pigs. Now, the features of common mycetism. Mushroom poisoning, ergot alkaloid produced by Claviceps purpurea. A source is rye flour. Clinical condition scent anthony's fire. Coprin poisoning caused by Coprin atramentarius. Source butter. Antabuse like reaction. Muscarine Incocybe fastigata, source food. Clinical condition cholinergic effect. Ibotenic acid mushroom poisoning or muskimol produced by fungal species Amanita pantheriana. Source edible mushroom. Clinical condition abdominal pain, vomiting, diarrhea. Cyclopeptide Amanita phalloides. Source edible mushroom. Clinical condition hepatocellular failure, green death cap. Now, the chemical causes of food poisoning. There are several non-microbial agents that cause food poisoning, such as capsaicin found in hot peppers, variety of toxin found in fish and shellfish, ciguatera, histamine fish poisoning, scombroid, and some chemical poisons, example heavy metals. Now, scombroid food poisoning, Morganella morgani, a common cell in sea fish, can break down histidine present in sea fish to histamine, which can cause food poisoning following seafood intake. Proper storage of fish in freezer less than 16 degrees Celsius can prevent this condition. It is a gram-negative bacillus, belongs to Enterobacteriaceae family. Okay, now coming on to the question. A group of patients presented to emergency department with chief complaints of fever, vomiting, and diarrhea. All of them had attended a birthday party 4 to 6 hours back. So it is a case of food poisoning. The clinical diagnosis, etiological agents, pathogenesis, lab diagnosis, and treatment modalities can be written on the basis of our studies. Now, Bacillus cereus food poisoning and food botulism we can write. Okay. For now, the MCQ food poisoning associated with contaminated Chinese fried rice. It's Bacillus cereus. Comorbid food poisoning is due to Morganella morgani and Staphylococcus aureus enterotoxin. All are true except is a preformed toxin. Yes. Incubation period is short, 1 to 6 hours. Yes. And the toxin stimulates the vagus nerve and the vomiting center of the brain. Yes. Treatment is mainly by the institution of antibiotics. No, antibiotics are not the first line of treatment. The mainstay of treatment is hydration therapy. All right. So this completes our chapter. Next, we'll be starting with gastrointestinal infection due to Enterobacteriaceae. Okay, like, share, subscribe. Thanks for watching.